Coronavirus has hit all aspects of society, but gender divisions are beginning to show. Women make up 70% of health and social workers, putting them at greater risk. Other industries where women dominate have seen heavy job losses, but those in charge of policy responses are predominantly male.
We do need to make sure that we are paying special attention to their needs, such as ensuring personal protective equipment, conditions of work that do not tax them and their immune systems, as well as policy measures that ensure that women are included in decision making. If you turn on the TV and you look at who's talking about the pandemic, it's mostly men.
With 90 countries in lockdown, 4 billion people are now sheltering at home, and the UN sees a shadow pandemic growing, violence against women. Latest reports show a 30% increase on average. In Europe, France saw a rise of 30%, in Argentina 25%, and Singapore 35%.
I urge all governments to make the prevention and redress of violence against women a key part of their national response plans for COVID-19. That means increasing investment in online services and civil society organizations, making sure judicial systems continue to prosecute abusers, setting up emergency warning systems in pharmacies and groceries, declaring shelters as essential services, and creating safe ways for women to seek support without alerting their abusers.
Evidence is also mounting that the economic impact of COVID-19 will hit women harder, as low-paying, insecure and informal jobs are female-dominated. Short and medium-term recovery strategies could include programs that build women's economic resilience for this and future shocks.
So what we need right now, specifically, is for the EU to enable and to ensure that governments are able to invest in essential public services into the long run and are not having austerity imposed upon them. What we need is to make sure that in designing stimulus packages or investment injections, that those are built around the reality of people's lives and the reality of women's work. So we need to make sure that that gender perspective is brought into the design and rolling out of those investment and funding mechanisms as well.
Mainly in less developed countries, women also face increasing difficulties in giving birth safely and accessing sexual and reproductive health services and family planning.